necessary. Yes, it's necessary. Your case sheet is a medical legal document. Whenever any problem is there, his patient is going to court. The court will ask for your diagnosis. Court will ask for your case sheet, whether it is OPD or IPD. And in your OPD, if you are not writing anything, the court will ask. If even after studying for 5.5 years and treating for 5 years, you are not able to diagnose, you're getting or not. So what is palmoplantar psoriasis? A variant of psoriasis characteristically affecting the skin of palms and soles. Like that, and sometimes it will be hyperkeratosis. Here it is, the correct modern part is palmoplantar psoriasis with the keratinization. Okay, clear? It is basically affecting the palms and soles. Sometimes it will be the hyperkeratotic. That's the feature here. In my case, sometimes it will be pustular or sometimes mixed morphology will be there. Clear? And what are the treatment options? Don't write Kushta. Okay, that's I am writing K only. You can write Shudra like Dadru K. Don't like Kushta. Why? Because patient by seeing Kushta, he will be gone. Okay, why? Because everyone is knowing Kushta. They are thinking that Kushta is leprosy. Okay, so whenever you are writing Kushta there, the patient will be gone at the same moment itself. Means he will be gone to heaven sometimes. That's why Dadru K. You can write Sidma K. It's okay. Sidma you can identify. The patient can't identify it. So what are the treatment options? Anyone? Treatment options. What you will give? Snehavanam. Okay. We write TwakVeda. Okay, good. Snehana. Snehana is needed? Yes, okay. In which form we can give that Snehana? As external application or internal application? Vamana. Okay. I am treating this case as an OPD case. Okay. I am not giving any Shodhana here. Okay. I am telling that point also. Okay. Dara Vitara Gudadi Kashaya. Okay. So my question is, what is the TwakVeda triad? The three prasada means the three medicine which can be given without knowing anything regarding Ayurveda or Tokroga. If a patient is coming to you, which are the triad of medicine that you can give to a patient? You are not knowing anything regarding Tokroga. You are not treated any of the Tokroga till your, which are the triad? Padola Kadurohini, Gandaka. How many of you have tasted Padola Kadurohini Adi or Padola Muladi? He will not give to the patient. Okay. I am taking one kashaya or one medicine per day whenever I am doing my practice in my OPD in Kerala as a medical officer. I am taking one kashaya per day, one kashaya or any other medicine. Okay, bitter in taste. Okay, good. So I will tell. This is the classical triad that without knowing anything, you can trust these medicines. Guluchadi kashaya, Villadi Guliga, Avipatti Churna. This is the classical triad you can give without knowing anything regarding a dermatology condition. You can close your eyes and write it. Clear? There will not. Why? Because Guluchadi Kashaya is the best medicine. Here also, on all the skin diseases, Pitta is affected. Isn't it? Guluchadi Kashaya is the best medicine for Pitta and Rekta conditions. It's very good. Avipatti Churna. Why? It is name itself. Avipatti. It will not cause any vipat. That's why it is called Avipatti Churna. It is not Avipatti Kara. It is Avipatti Churna from Sahasra Yoga. Okay, if you want that sloga, I will give you to Rahul. Okay. Then Vilvadi Gulika. You are knowing Vilvadi Gulika, I think. In diabetic patients, we cannot give Avipatti Churna. Okay. There are options are there. This is the classical triad. So I am asking, I am not giving this medicine to this case. Okay, I will tell. So I will show the case. Okay. The treatment options. It is a black lesion, hard lesion, isn't it? Vada Kaba is involved. Rokshada is there, isn't it or not? So you want to check all these lay. Okay. So Lehya or Roksha is or Sneha is involved. What is your answer? So these are the options you can give. I will tell what is the medicine that I have given. You can go for Aragudadi Kashaya. You can go for Gugulu Diktaka, Panchadiktaka, Kaishora Gugulu, Vilvadi Kuliga, Manibhadra Lehya, Trivid Lehya. As external, you can go for Asotamadi, Jivandyadi, Gandaga Malahar. So I will tell. Okay. Okay. Please see. This is the case on 18/12/2018. I am showing the case pattern. Please see. Okay. After 3 months, I'm not giving any internal any Shodhana. Okay. March, June. It has taken 8 months. Okay. Clear? What medicines you can give? This is a case that is treated by myself itself. What is the medicine that you can give? You can give for options. You can tell the options. On the basis I have explained everything regarding the case. She is having Rukshada. He is having constipated bowel. She is having poor mindset. The mindset was disturbed. Okay. So, Rasotamadi, Avagaha with Gomutra followed by Malahara. Okay, I am doing this case as an OPD basis. Okay, Amapajaga. Okay, he is having Amatwa. Whether he is having Amatwa. Srodoroda Balabramsha Gaurava Anila Mudada. Anything is there or not? Yes, okay. So this is the treatment that I have given. I am not giving in the first stage. Why Manibhatri Lehim? Anyone? Why Manibhatri Lehim? Vibhati, but okay. Why Manibhatri Lehim? I have given Manibhatri Lehim. Why? Yeah. So please listen. Whenever we are asking, everyone is asking, telling me about the type of line of treatment. So as a doctor, this is my next task. I'm telling the medicine should be in your fingers, and the line of treatment should be on your brain. Don't tell the line of treatment. Medicine should be coming to your mind or in your finger. Your medicine, you want to write it as fast as possible by checking it. This patient is having Rukshada, Krura Koshta, Vada Vriddhi is there, acute pain is also there. You want to check about the Pitta also here. Why? Because Pitta, with the Vina Pitta, without Pitta, no skin disease. Clear? Manibhadri Lehya. It is a Lehya preparation you have studied in Vada Vyadhi Adhyaya itself. Okay, whenever you want to do Snehana, you can do in the form of Lehya or any other thing, or in the form of milk you can give. Here also Lehya, Manibhadra Lehya. Okay, I am not giving as Virejana. I am giving in a small amount. You can see half teaspoon at night. Okay, this is Shamana dose. Okay, Manibhadra Lehya, half teaspoon at night for reducing the constipation, for reducing the vada vriddhi, and also sustaining the pitta. Next, Panchatikta Kashaya is the Kashaya that I am opting here rather than Gluchadi Kashaya. Why? Because it is also having Kaba Pitta. You are knowing it is hard lesions are there, Pitta is involved, and Kabaja, blackish lesion, black hard lesion is there. So Kaba is also Grandhivat. You are knowing whenever it is Grandhi, Kaba, you are knowing Grandhi is also having Kaba involvement. So I am taking Panchatiktaka and I am giving only 15 ml Kashaya with 60 ml. Anubana, water only. I am not giving any other thing. And I am applying Rasotamadi Leba. No oozing is there. If any typical oozing is there, no external. According to my experience, if any oozing is there, no external application is needed. Don't go for external application whenever there is oozing. Why Kashayam after food? Nice question. I am giving Kashayam only after food. Why? Because I have seen so many cases in which patients are having. Why? Because I think it is a bottled kashaya. Panchatikta kashaya is a bottled kashaya. It is having preservatives, and this preservatives is causing some. I have seen in my patients they are having some gastric issues. So according to me, I am giving bottled kashaya only after food, and it is a pattern which is followed by my guru, Dr. Balakrishnan sir, and is very much effective in my case. And Vilwadi Gulika, here it is basically Vilwadi Gulika is a best medicine for Krimikna property. Okay, or any Kushtaroga, I am basically giving Vilwadi as a subsidiary drug for, it is not for Koshta Shodhana, it is basically for Tok Prasadana or Rakta Shuddhi. Vilwadi is giving for Rakta Shuddhi. This is the first stage that I have given this kashaya, this thing. And whenever that Rukshata was gone, I have changed to Avipati. Avipati is simply Ruksha itself, isn't it? After 2 months, I have changed to Avipati. I have stopped Manipatra Lehya, changed directly to Avipati, and I have added Rasotamadi Leba. Okay, you are knowing I am telling that Rasotamadi, why Panchatikta Vada is involved. No, the Panchatiktaka is basically Tiktaka is the best option. You are knowing Panchatiktaka is the first line of Mahatikta Kashaya. You are knowing that Gugulu Tikta Kashaya. But a problem is that Gugulu Tikta is very much Ruksha. Okay, so it is not possible to give a Tiktaka Kashaya like that. So I am opting for Panchatiktaka. And this is the answer. The basic answer is it is more available, most available there. My option was to go for a Ragudadi Kashaya, but I am giving this as a first option, and it has worked there. And just I am following that. Basically, Vada Kabaja, blackish lesion. The best option is I have told that the best option is Aragudadi Kashayam. In this case, the best option is Aragudadi Kashayam for this patient, but Panchatikta Kashaya was available there at that time, and I am moving with that. Manibhadra Lekhya for Ruksha and Virechana. Rasotamadi, it is not oozing type, it is hard lesion. I want to reduce the hardness, so I am giving a leba, Rasotamadi leba, which is having skin-friendly sulfur drug also. It is giving as external application. And Vilwadi Gulika, I am giving basically for all the skin diseases in my life. It is a very good skin drug that I am using in all the my life. It is a very good drug, wonder drug in skin disease. Basically, I am giving for Rakta Shuddhi. It is my own experience, I am telling. Ointment. Yes, ointment is there. In the second stage, I am changing the labor. Along with labor, in the morning, I am asking for applying Sorset ointment. And in the evening, I am asking to apply the Sotamadi labor. Clear? I want to check whether it is Obeshe or not. That's why I'm giving Rasotamadi Leba. I am having full confidence. And in the next part, I have given Sorset ointment. It is a preparation of Aushadi. Okay, it is very much effective. In these conditions, has treated so many Vibhadika cases for all the condition. This Sorset ointment is also very good. It is a medicine for psoriatic conditions. For all psoriatic conditions, this medicine is very good, according to my experience. Sorset ointment is a preparation of proprietary preparation of Aushadi. Aushadi, it is the government, like IMPACL, Government of Kerala is having a medical corporation for medicine preparation. It is called Aushadi, and it is the preparation of Aushadi itself. Okay. Have changed only this medicine to Avibhatti Churna, 1 teaspoon BD with lukewarm water. Okay. I am not changing anything. And after 2 months, after 4 months, I am stopping this Kashaya also. Only Avibhatti Churna and Vilwadi. After the application, whenever she is coming, it is having like this. After Asotama, the application, it has changed like this. So I'm thinking that, okay, that lesion is a little bit going. You can think that the crust is somewhat dissolved. It is liquefied like that. Okay. And after this third visit, it is seen that it is reduced. At that time, I am starting the ointment. Clear? At this time, I am starting the ointment. Sorset ointment and Rasotamadi in the morning, Rasotamadi in the evening, and Sorset in the morning. And I am telling that Sorset ointment only for 1 hour. Just 1 hour, we want to remove it. Just scrap it off. But the Rasotamadi labor, she can apply and have the sleep itself. But what is the problem is that whenever you are telling to apply it over the night, sometimes by in the hand, whenever you are applying on the hand, sometimes if he is just licking her hand during night, it is a problem. It is a resa drug. Okay. So don't tell the patient to apply during night in the hands or any other places which is easily having a problem with the mouth. Clear? Slowly, it is going on. The same external application is happening more. And I'm stopping the Kashaya at that time. It is moving like this. It is reducing like this. Hard lesions are gone. She is very happy. And my friend is telling that it will be coming back. So I am closely monitoring it after 8 months. And at last he is telling nothing other than this. My everything is clear, both is clear, hands are clear, and she is very happy. She is having no other problem. I have stopped all the medicines for that patient. Clear? After the we have shifted to Avipati Churna, after the Snigdhada has been gone. Means after the Amrita was gone, her constipation was relieved. Constipation means that Snigdhada was relieved. I can shift like that, I have thought. Why not Mishraga Sneha? You can also go for Mishraga Sneha, no problem. But have you tasted it? Please check all these medicines by year on, whether Chardi will be coming or not. You will induce vomiting in the patient whenever you are giving any Apunarbhava Chikitsa, means cap form. According to me, I am using the direct form itself. Okay. Okay, you can Kashaya tablet. I am preferring Kashaya. For me, the best thing is Kashaya Sukshma Churna. One Everest pharmacy is there. They are having Kashaya Sukshma Churna. It is the best thing rather than tablet or bottled Kashaya. It is very much effective. It is very fine powder Kashaya. It is an innovation by them. It is very good. Clear? So this is the message that I want to give. Need of easily available treatment options. Here it is, Panchayatiktaka is there. Gluchaji was not available at that time. Panchayatiktaka was there. That's why I'm moving with that drug at that time. It is also you want to check which medicine that you are having. Sometimes it will be available, it will be free for you. And why are you preferring for a drug from outside? Whenever it is available with you, if you are having options with you, that's the next question, answer from me. I am giving only 4 drugs, you can see. Okay, I am giving only 3 drugs. I am not giving Arista also for this patient. Okay, I am giving only these options, these 4 drugs. Okay, I'm not taking any other big medicines, and all these are available in my dispensary itself. It is a government dispensary. I was working there as a medical officer from 2018 onwards, and that's why. So whenever it is available with you, which is having low amount or low cost, you want to go for. Okay, Shadadavda Grudam is also effective in this condition. You can go for Jivandyadi Amaga for external application. It is also effective. But according to my experience, Rasotamadi is very good in these options. When it is a crust, fissure, black hard lesion, the best option is Rasotamadi or Jivandyadi rather than Shadadauda. And this Orset ointment is having very good results in my experience. I have seen so many cases like this. I'm just giving one example. Clear? So this is the message that I want to convey, need of easily available treatment options. So the question, are you getting bored? Whether you are okay with the class, I think we have covered 1 hour now. Whether you are okay. I think I want to cover it to three clinical, but I am unable. I think I will try my level best. 9:30 tak we can do. So my next, this is the question from this case. What is the importance of the word Krura Koshta? You have heard Krura Koshta. And intentionally I have given there. Mrudu Koshta and Madhyama Koshta you have studied. What is the importance of this Koshta in this case? In relation to this case, please give the importance of Krura Koshta. Or the word. You have studied Krura Koshta, Mrudu Koshta, Madhyama Koshta in your first year physiology classes. So what for what purpose you have studied? Whether there is having any relation with this case. In respect to this case, you want to answer. That's why I am given, I have given Manipatra Lekha due to this Krura Koshta. To assess the bowel. Okay. Why it is called Krura? Why Ajar is giving a word like Krura? Why it is called Krura? Have you checked it? I was having a problem during my UG studies. I am checking why it is called Krura, why it is called Mrudu. Okay, you're getting that point. Why Ajay is giving like these names, ridiculous names? Hard? No. Okay. What hard? Very difficult to defecate. Okay, that's why it is Krura. No, a little bit different. Sloga is there. Sloga is there. Sloga is there. If anyone is knowing that sloga, please tell. Otherwise, I will give the explanation. Why it is Krura? Constipated, it is correct. Why it is Krura? Constipated like that. Okay, I will give. I will give. If you are having answers, you can tell. Otherwise, I will move forward. Okay. So, Krura means cruel. You're knowing cruel. So, Susruda is giving this explanation. Susruda ni Dalhanan. Okay, like a king extracting maximum tax from the people, this koshta absorbs maximum water content. You are knowing regarding large intestine, isn't it? Absorption and secretion is there. That loop is there. You are knowing that. So, like a king extracting maximum tax from the people, this koshta absorbs maximum water content from the food, means waste food, and secretes only little amount of water. Yes, one has answered. That's why, resulting in hard stool. And why it is called krura? Over taxation is cruel. Hence, it is called krura koshta. It is mentioned in Susruta Dalhana. Please check it. I am not telling the answer. It is written in Susruta. Please go through that. So, can be given strong laxatives only. That's why I have gone for a strong laxative like medicine in Shamana dose. Okay, that's my answer. Clear or not? Krura koshta. You're getting that meaning. Why it is called krura? I think you have studied in your first year. This is the meaning. Okay. How many of you are knowing this meaning? It is krura, like this extraction is the krura thing which is happening. Okay. Rohit. Okay. And mrudu, you are knowing. Soft. Minimal water content, absorbs very minimal content and secretes large amount of water back. Okay. Resulting in loose stool. So the soft nature of koshta. So they will get virajana even with kshira or draksharasa. So it is very much important to check the cost of the patient. Okay. Madhyama, it will be optimal. Okay. My laxatives. Once my teacher, Dr. From Panchakarma, okay, Manoj Kumar sir is doing a study. So what he has given Avipatti Churna to all the hostelers of my class. Are you getting? So I am a Pavada Prakriti. I am taking Avipatti Churna. By afternoon, I am not having any of the Vega. By afternoon, what happened? I am getting very much hunger and I am eating my food. And my friend who is Pitta Prakriti, okay, what happened? He is going for 7 or 8 times. Okay. And one of my friend who is Kapha predominant, he is going for 2 or 3 times. After 1 week or two, after 1 month, the same person is giving air and Taila to all the hostelers. At that time, I am Vada Prakriti. I am going more times. I am going for 4 or 5 times. The Pitta Prakriti person is also having, but not like that, me. For Vada Prakriti, the best thing, Krura Koshta, the best thing is air and Taila. For Mrudu Koshta, Kshira. For Madhyama Koshta, it is Avipatti Churna. Nature of bowel is also very much important in while prescribing medicine to a patient. Clear? This is the message that I want to convey. You want to assess the koshta of the patient also. Clear or not? Rahul Doctor, whether we can move for the next case. I think 9:30 is the time,
Yes,
isn't it?
yes, sir. Please go ahead.
You are okay with this? Whether you are bored or you are getting something. Clear or not? You are knowing all these things. Okay. So it is a large case. We can move up to the time. Baki next class we can. So a 15-year-old normosenic male patient. Okay. Reddish pink skin lesions with severe itching over abdominal region for 1 month. It is a new case. Okay. Only 1 month. At that time, whenever it is coming to me, had taken allopathic medicines and symptoms reoccurred again. Okay. And this is the case. You can see the photo. Clear? I think the lesions. What is this lesion? Maculopapillar. What is this lesion? Now you can able to identify. Wheels. Please see. This is a typical lesion. What is the lesion? How you are telling Guttate psoriasis? Correct. Why you are telling Guttate psoriasis? He is a Pitta Prakriti. From the figure itself, we can identify it is a Pitta Prakriti patient, isn't it? Color, you can identify it's a Pitta Prakriti. Okay. There is history. Whenever I am examining the patient, it is raindrop lesion. Yes, that's the correct answer. It is a raindrop lesion, which is called guttate. Okay, that's the name guttate. Raindrop lesion. That's the correct answer. Like raindrops seen. This is a typical feature of guttate psoriasis. The correct answer is guttate psoriasis. I will tell. So, a patient is a Pitta Prakriti patient. History of sore throat is there. Patient is telling about a history of sore throat, basically due to streptococcal infection. Guttate lesions. What is guttate lesions? I will explain. Scaling is present. Okay. Candle grease sign is positive. What is candle grease sign? What is candle grease sign? What is candle grease sign? How many of you have done candle grease per sign? Don't do by your own hand. Okay. Ask the patient to do it. Okay. So it will be exfoliating scaly lesions will be coming whenever you are making flakes or scales will be coming from. It is called candle site. Ask the patient to do this. Okay. Sometimes bleeding is also there. So what is your Ayurvedic diagnosis? Scratch the lesions. Scales come out.